Dr. Jasani, thank you so much for joining us here this evening. And I wanted to present some thoughts and questions to you with respect to renewal therapy and really what it really means. And I think that the first place I'd like to start is by asking you, with respect to what stem cells actually do. There's three primary areas that we focus on, and that is the science reflects that they seek out degeneration by building, repairing, and creating new tissue. Science reflects also that there's an anti-inflammatory component, and then the remaining portion or bullet point with respect to the science is how they help modulate the body's immune response. And these are all quotations taken from Dr. Neil Reardon and some of the studies that they've done at his clinics in Panama. And I know that you had a chance to go directly to one of those clinics. But would you speak directly to these three different areas of specification when it comes to renewal therapy and what we're offering by deriving the cord blood directly from the umbilical cord and providing that directly and on an infusion basis into patients? Would you speak to that, please?
Yeah, sure. So, stem cells is a very broad topic. When we go back and we look, there are a multitude of different stem cells, not only tissue specific, but hematologic stem cells that make your red blood cells, white blood cells, platelets, et cetera. And, what we're specifically talking about is very early mesenchymal stem cells that are present in the umbilical cord blood. We all have mesenchymal stem cells. And as we age, these stem cells they tend to reduce in quantity. We have them everywhere in our pericytes, which are small cells that line our capillaries. So those stem cells are really the conductors. If there is damage anywhere, there's inflammation, there is immune enhancement, they will be able to pick up on it through something called cytokines and chemokines. That's how they pick this up. It's called paracrine signaling, and they will then conduct and cause other cells to come in to either repair the area. They themselves will differentiate into cells to fix it, or they will drive down inflammation through these cytokines and other signaling pathways. They also can immunomodulate, where they will enhance suppressor T cells. They will enhance macrophages to a level where you may have high levels of autoimmunity, and these can potentially immunomodulate it. Now, these are very broad topics, and we do know that mesenchymal stem cells carry these properties. Where we have started to really see benefit is they were starting to use them in local and regional treatments, such as joints, and injecting them near arthritic joints, and expecting them to improve inflammation, improve the surrounding structures. And they actually noticed there was improvement in cartilage, there was improvement in pain, there was reduction in inflammation. And as we've started to use this, as you can see out in the medical world, people use platelet-rich plasma. It's the same theory. They are trying to use growth factors in our plasma to kind of stimulate and help with inflammatory sites. Well, mesenchymal stem cells now come from the umbilical cord, and we have an ability to extract them from the umbilical cord and giving them either locally or IV. The thought is that those cells, if preserved right and extracted correctly through a lab, can home in and seek out inflammation through the same paracrine signaling pathways, reduce inflammation, immunomodulate the area, and even differentiate into cells for repair. Now, a lot of the data and science is early. There's lots of mechanistic studies. There are numerous studies, even in the US and around the world, that have done this on patients. They have seen significant benefits. It is still very early, so you have to take these all the way through stage 2 and 3 clinical trials. But there have been literally hundreds of thousands of patients been given these therapies across numerous clinical trials, off and on label. And now, this is kind of where we come to with stem cells. I mean, we are really looking at these three categories: seeking in on inflammation, trying to improve and immunomodulate the area, and anti-inflammation. How they do it and what the specifics are extremely interesting, and those are really where science is taking us, and we're trying to figure this out. And this is where I think in the next 10 years, you will begin to see some of this incorporated into conventional medicine.
Dr. Jasani, you mentioned that there is a decline, and I was curious, We know that the reflections of what science says through some of the narratives in the publications, that we start with about one stem cell for every 10,000, but by the time we're age 30, there's one for 250,000, and then by age 80, one for 2 million. Can you give me a little insight as to how they measure this, how this is measured?
That's difficult. I mean, these are things that are taken from bench science research, PhDs who study this in the lab. I really couldn't tell you how they're mechanistically really doing this beside modeling this. So what they're probably doing is figuring out how many stem cells are coming from the embryo, and basically from the umbilical cord, blood, and just extrapolating through the basic science knowledge that we have. I really couldn't tell you exactly how they get to these numbers, but what it conceptually tells you is we know as we age, our stem cells not only reduce, sometimes they can go awry, and the combination of the two, having healthy and plentiful stem cells, likely lead to some level of prevention of degeneration, anti-inflammation, et cetera. And as we age, it's a very complex process through epigenetics, and some of these things are probably affecting these mesenchymal stem cells.
In the medical community, we have a tremendous amount of deep thought and look when it comes to science and study. Yet we seem to have an anecdotal result pattern that's pretty amazing. And how do medical professionals like yourself view this when you see patients and clients and people that are designating, in one instance where they have severe joint pain, where they no longer have that pain, where there's significant anecdotal signs? How is that characterized, and how is that perceived by a medical doctor like yourself?
Yeah, that's a good question, and that is a very important topic. As medical doctors, we are trained based on evidence-based medicine, randomized clinical trials, et cetera, to try to drive the best value to the patients. That is exactly how we get pharmaceutical medications and different surgical procedures and devices approved through the FDA. And that is the pillar of medicine. But, as an oncologist and practicing for many years now, we understand there is an art to medicine as well. Not everything can follow the science. The human body is an engineering feat, and there are significant amounts of interventions one can do, from sleep, nutrition, supplements, exercise, where we see quite remarkable changes in the human body, changes in people's disease processes. Not to say that those are a cure-all for everything, but they do form a pretty solid foundation. And we don't have evidence-based guidelines necessarily for those things either. And yet we counsel patients, and I do very aggressively, on those things such as sleep, nutrition, exercise as a baseline pillar. And then we layer in evidence-based interventions such as surgery, medications, and devices on top of that. So science is always blended with these types of natural interventions. And yes, they are anecdotal. I talked to many of patients who have had stem cells and have had quite remarkable changes. And some of them are in the allied science fields, dentists, neurosurgeons, orthopedics. I've seen some of them go down there and get their own treatments. And I think that in the end, people are just trying to drive real value and trying to make sure there's minimal risk. So the first thing we want to do with an intervention like this that is natural, that is not via the FDA, because it is not an altered product, so it is not considered a drug, is to make sure what is the risk. If the risk is low, then what is the benefit? And then we can approach people with it. If the risk is there, then I would not approach any patient with anything until we have the evidence. But there are hundreds of thousands of people who have received these treatments on clinical trials and off. And overall, if you have specific products like the mesenchymal stem cells, unadulterated, pure cryopreserved, I'm not talking about the situations that you read where they have, labs that are giving false products, et cetera. I'm talking about pure mesenchymal stem cells. I think the downside risk is very minimal. And I think, if anything, it can add value and improve. And some people, it can be life-changing if they have dramatic improvement in their chronic disease processes. They are also processes where we don't have conventional medicines or surgeries to cure these underlying ailments. We just don't. We have things that can help with inflammation short term that carry lots of side effects. And a lot of these things are unfortunately all we have, and our patients do have to take them. But this is another avenue to try when you have chronic pain, chronic inflammation, to see if you can allow a better, more meaningful improvement in symptomology, which may allow you to do exercise and other things to help your underlying condition. So, that's how I look at this, from an evidence-based and a holistic and a wellness-based practice. And I think you have to have a blend of two. You cannot be leaning on to just one or the other. Medicine has come a long way, but in the end, our nutrition, our health, our exercise, and underlying core foundation is very important.
Yeah, the body is miraculously capable of doing unbelievable things when it is when you have the right nutrition, the right amount of rest. It's a really, in many instances, able to do far more than most people recognize. In conclusion, Dr. Jasani, you personally have had this therapy on a couple different occasions, and would you mind speaking directly to what the benefits are, whatever benefits you may have received anecdotally?
Yeah, I first seeked it out because I have a very unique inflammatory dry eye, which I was trying anything for. And I did seek it out for that. And I did actually notice increased lacrimation and tearing, which is something that we take for granted, but it is a big foundation of your ocular surface and your tear film. But secondarily, it gave me significant amounts of energy. I had some mild joint aches from all the exercise and HIIT training I do, and I could notice improvement in some of that, actually. And I think that when you really look at this, I actually had another person that was with me that was a dentist who was getting it almost, this was her 9th time, and they had 2 knees that were totally gone. She was a dancer, and she goes, I couldn't walk. I have knee crutches and a walker till I got these stem cells. And my goal was to just hold off a total knee replacement as long as I could. And lo and behold, she's almost 10 years out, receiving stem cells every 18 months. But she goes, it allowed me to, I'm actually able to do the things that I enjoy, including dancing, which was unheard of if I hadn't gotten a knee replacement, which she still couldn't do. So, for me, it was those subtle improvements. And I think that based on what one's underlying issues are, you can speculate who would have certain responses based on their underlying condition. Now, we are clear to people that this isn't something where you just take and all of a sudden all your ailments go away, but it is, very helpful for things such as chronic inflammation, degenerative arthritis, autoimmune arthritis, where it may or may not treat the underlying issue, but it will definitely help those joints and the inflammatory sites.
Seems to be overwhelmingly the largest area of result anecdotally that we see reported is areas that are joint related issues and pain. That certainly was my case. There were other benefits in conjunction with that, but primarily just removal of the pain. In my left hip, my right hip was already replaced, so I'm very familiar with how that pain felt. And scans did show a decrease of some of the cartilage in around, but not complete. So now I'm excited about the new scans that we're going to be doing and taking a look to see any of the objective differences, as we've seen with other scans, both skeletal and also MRI where joint tissue is related. So to me, as you mentioned, it's a combination of looking at the holistic perspective as well as the study and the medical perspective, and trying to gain more value as we continue to increase in time. I do believe that this will have an impact on healthcare. What's your outlook over the future with respect to this area of regenerative science, therapy, and medicine?
I think it's going to be used in a lot of facets of medicine. It's already in clinical trials at a lot of major universities. I know they're doing trials in rheumatoid arthritis. I know they're doing trials in orthopedic degenerative arthritis. And I think overseas you are seeing a lot of these used in these trials. I know some of these mesenchymal stem cells are used locally, and they're trying to use them to see how they can formulate actually formulation of organoids or organs in the lab. Now, these are early and these will go through all the appropriate trials, but I think that at this point, you'll see over the next 5 to 10 years a significant rise in the amount of data coming out for use of mesenchymal stem cells.
Fantastic. Well, Dr. Jasani, I certainly appreciate your time helping us with this Q&A on this particular call. And we'll take this information and repurpose it for purposes of education and information that can give people a better idea from all these different perspectives. Thank you so much for your time. We really appreciate it.
Absolutely. Thank you.